My research topic is the treatment of narcissistic personality disorder. Some topics I will talk about are collaborative therapeutic assessment, metacognitive interpersonal therapy, schema modes, couples therapy, and prevalence of personality disorders in general population of women and men. The definition of narcissistic personality disorder is a pattern of grandiosity in fantasy and behavior. They often feel empathy and ignore high and low self-esteem. A person diagnosed with narcissistic personality disorder also feels shame, boredom, and emptiness. The first topic I will speak about is prevalence of personality disorders among women and men. The study was conducted in Poland and a population of women and men between the ages of 65 and 18. The first part of the study was to conduct a questionnaire, and the second part was to conduct an interview. However, the population number changed because not everybody else consented to the interview. The results of the study found 9% of the population had a personality disorder. However, narcissistic was 6% of 720 women and 7% out of 700 men. The next topic I will speak about is collaborative therapeutic assessment. In this treatment, tests are concluded along with an interview. The author states that CTA allows the patient to be in the role of themselves. They can define what they learned and if it answers their questions. The study was done with a man. After the study was concluded, the author wanted the patient to find a sense of independence and self-reliance. This would help draw out his narcissism. The next topic I will speak about is metacognitive interpersonal therapy. Metacognition is the ability to recognize mental stats and use knowledge to tackle social life. Without the knowledge, people lack awareness and trigger reactions. MIT considers poor self-awareness, and the goal is to understand problems and make them aware of their mental stats. Metacognitive interpersonal therapy uses the process of stage setting and change setting. In stage setting, a patient puts their mental stats in stories and narratives and identifies their problems between relationships and their wishes. In the change setting process, the patient understands their problems and promotes healthy aspects and behaviors in accordance to their wishes. When stage setting and change setting was used in this article, the man had serious narcissistic personality disorder. Using the tests of stage setting and change setting help him gain a relationship in his life. The next topic I will speak about is schema therapy. This therapy uses different therapeutic elements while focusing on attachment, autonomy, and parenting. The population was male with different personality disorders. The results showed trending levels. The next treatment I will speak about is couples therapy. The author states that these individuals come to attention when their marital or significant relationship runs into difficulties. There is often one partner who is angry and one who is sad. However, the narcissist defends against self-esteem. The couples therapy allows them to open up and have a need for a relationship. The study focused on 2 couples. However, one couple did not succeed and the partner went back to his mysterious ways. But one couple did complete the couples therapy and was able to succeed because of the ability of being open with each other. For these treatments, my viewpoints on them is that to treat narcissistic personality disorder, it's not a pill. Most of the time, the mental disorder is treated with a pill. Schema modes could be used to treat narcissistic personality disorder in a variety of areas. It just depends what type of narcissistic personality disorder and what areas need to be treated. That's why it's a little bit trickier. Metacognition focuses on the problems and it finds a way for them to solve it. It uses their real life, and that's what I like about it, because they're able to understand what's going on in real life and able to fix it in a real life way. Collaborative therapeutic assessment allows the therapist to get to know a person and be able to study them using tests that are done for humans, like questionnaires or some other thing. It allows the person to use their brain to answer their questions versus answering their questions on some type of drug where their answers are not completely true. The prevalence of personality disorders was pretty neat because there are various ones, but to find that there is a low percentage in that particular country was a very nice thing to know about. So I really enjoyed that. Couples therapy I also liked because couples therapy allows a person to be open with their feelings, and usually a narcissist is against that. So the fact that a person can trust somebody to be open with someone is pretty neat. To be able to have somebody open up is a very hard task, particularly in a psychosocial area. How I feel these treatments can help somebody in the human service field is like I said before. Most mental disorders are cured with a pill. And most of the time, a patient's answers are not honest because of the side effects the pill gives them. For example, nausea, shakiness, dizziness, drowsiness. And I feel it doesn't help a person. Using these treatments against narcissistic personality disorder allows a person to be a person. It allows them to be human. And I feel like these treatments would help in the human service field because there's an alternative to using pills. Most of the time, a patient does not like to take medication because of the side effects that they receive. They can be a little bit brutal, or sometimes their body is not very popular with the medication they're taking, so it causes their symptoms of the pill to be more harder than usual. So I feel like these treatments can help a person feel human, feel that their opinion matters, feel that what they're trying to treat, somebody is listening to them. So that's how I feel about them being used in the human service field. However, to use in a human service environment, you have to be trained and be willing to use them, because not all the time does the doctor want to use these type of treatments. Most of the time, a doctor will start them on the medication and see how it goes. But it's not always applicable. Sometimes the patient does not take the medication or doesn't like it because of the side effects, like I said before, that they're receiving. So if a human service professional is treated or trained to use these type of methods, I feel they should use them in their environment, because I realized a patient who uses these type of treatments feels a lot better as a person. They don't feel that their disease is taking over them. That's my opinion on the matter.